This is Dr. Rick Pumill from Cross County Cardiology, and welcome to Whiteboard Wednesdays. A disorder that we're asked about often is what is endocarditis, or what is a heart infection or heart valve infection. Endocarditis means that for some reason bacteria has gotten into the bloodstream and it's stuck to the heart valve, and that grows on the heart valve, and pieces can break off and embolize to different areas. So when we think about it, it is more common after heart surgery with valves. So if somebody goes for dental work and they don't take antibiotics, or somebody has a colonoscopy and they didn't take antibiotics and bacteria enters the bloodstream, it can stick to the heart valve. We see it in intravenous drug users. That's typically the tricuspid valve that would get infected because bacteria enters into the bloodstream and sticks to the valve. There are some people with underlying disorders like rheumatic heart disease where the valve is a little calcified and go for dental cleaning, bacteria can get in and attack the valve. Antibiotic prophylaxis, or taking antibiotics prior to certain procedures, the guidelines have favored not taking antibiotics unless there's very specific indications. But lately, we've been using more individual discretion, and in people with severe mitral valve prolapse or very calcified aortic valves, giving them amoxicillin or clindamycin if they're penicillin allergic once or twice a year. I think that the benefit outweighs the harm. If we're talking about heart valve infections or so-called bacterial endocarditis, we're thinking about a valve getting bacteria on it from whether it be dental work, or somebody gets cut, or they have infected toenail, and that bacteria getting into the bloodstream, attacking the heart valve, and that can be quite catastrophic if not caught early and treated aggressively. So what are the symptoms of endocarditis? Typically fever, chills, night sweats, you can have shortness of breath, and you can see some embolization. Anybody who has symptoms of fever, chills, night sweats, whether it's bacterial endocarditis or something else, it needs to be investigated and aggressively treated. So thank you for tuning in today for Whiteboard Wednesday.